I would like to introduce Dr. Adarsh Vijay Mudgil. He practices here in New York with offices in Manhattan and as well as in Long Island. I think this is the first time I ever heard that somebody being recognized as a New York super doctor, and I'm super excited to talk to you about vitiligo today. I think this is an accolade that only a 5% of physicians get it, and I'm thrilled that I have you at VitiTalks today. What really drew me to come to this conversation today with you was your acceptance, just looking at patients and being accepting of their condition was so empowering with your videos that I've come across. And I thought you would be like a perfect person to shed a little more light onto VitiTalks about vitiligo. So I welcome you, and I'm really thrilled to have this session today.
Well, thanks for having me. If I could just say it's nice to be somewhere where my name is pronounced perfectly. And very, very rarely I think this is the first time ever in years. So
thank you.
I'm really glad to be here.
Thank you. Thank you. Also want to take a second to introduce Suhail. Well, that's actually my connection to Dr. Mudgil now. And I'm thrilled to actually share this forum with you because I know this is how we connected over vitiligo. And I've never seen like a male Indian side of vitiligo, which will be an interesting conversation to have. So I welcome you and I'm looking forward to this conversation today.
Sorry. Thank you.
I do want to get started with my top 3 questions about vitiligo that I always come across. So just a little bit about myself. I grew up with vitiligo. I was diagnosed with vitiligo at the age of 4. I have lived most of my life in India, so I have been surrounded with myths, misconceptions, and misunderstanding of the condition. And VitiTalks is an initiative to just help this kind of misconceptions and myths out of persons who are living with vitiligo. So my top 3 questions, I always ask all the doctors because I know this is something that I've always heard throughout my life. So does vitiligo happen with eating fish over milk?
No. That's a funny question. It's there's so many misconceptions when it comes to vitiligo. With skin diseases, your patients, the public can see what's afflicting them, and vitiligo is one of those conditions where it's very, very, it's what you see. It's very prominent. Vitiligo frequently affects the skin of the face, the hands. These are parts of the body that are difficult to cover, and that everyone's looking in your eyes, everyone's looking around your eyes, everyone sees these things. And there's so much, especially, and I'm this is going to sound like a brown on brown crime, like my comment, but Indians are very judgy generally. And there's also a lot of theories that all the aunties and uncles have about the causes of these sorts of conditions, and I can tell you none of them are rooted in any science whatsoever. So I haven't heard that particular one that you just asked me, but no, there's absolutely zero correlation. There's never been any food or any particular diet preference that's been associated with vitiligo.
Okay, thank you for clarifying that. That is actually, if you grow up in India, that is like the first question that people will ask if they see a white patch on you. Oh, did you eat fish over milk? Did you have the 2 items into the same meal? And then the next thing that comes to my, that is a very popular question around vitiligo is it contagious?
Yeah, absolutely not. So the vitiligo is purely an autoimmune condition. No one can catch it from you. You can't give it to anybody. It's not infectious at all. So there's no way anyone can get it from you.
Perfect. The third question that I have on this list is it hereditary? If you have vitiligo, are you going to give this to your kids? Are you like infecting somebody's bloodline with vitiligo?
That's a very good question. It's also a very complicated question. So the genetics of vitiligo, I'm a clinician, I'm not a scientist, but the genetics of vitiligo are very complicated. So there have been some genes that are associated with vitiligo, but their transmission between generations is not so clear. So sometimes a gene, particularly in patients with vitiligo, can sporadically turn on. and no one knows what does that. And that's the majority of patients who have vitiligo. I'd say most of them don't have someone that has vitiligo in their family. Maybe 7%, 5%. You know, the statistics are kind of all over the place. There are some studies that show that folks who have extensive vitiligo, there's like a 30%, up to 30% transmission from generation to generation. And again, the genetics of that is very, very unclear. That could be perhaps where there's two lineages that are vitiligo prone, and then that increases your risks of getting vitiligo. Indians in particular have a lot of autoimmune disease in general. I don't know why. I don't think anyone really knows why, but you know, conditions like thyroid disease, diabetes, other autoimmune conditions, very, very prevalent in the Indian community. And you know, it just may be that as Indians, we have just a genetic predisposition to express autoimmune conditions. Again, the genetics are very, very unclear. There probably everything is genetic to some extent. There probably is some genetic component, but for vitiligo, it's not like a 50-50 chance. You know, it's not like an autosomal dominant or autosomal recessive condition where the genetics are very, very clearly elucidated. These are sporadic genes, which we're still figuring out. And is there a genetic component? Probably. Is it a significant genetic component? Probably not.
Hey, thank you. Thank you so much for that. So I was actually watching your video with Mohammed, where you actually did like a walkthrough with a person living with vitiligo. And I do have some questions from that video that, you know, if I was there, I would have loved to ask you these questions. So I know that it's an autoimmune disease, and the melanin is missing from the cells. And then, you know, I actually grew up thinking that there was no treatment. Like, I never went to a dermatologist to find out if it was a curable disease, because all the doctors that I was talking to, or the family members and stuff, the first thing that was coming up was like, oh, there are no treatments for this condition. So I really want to know, are there treatments that are available for people with vitiligo?
Yeah, absolutely. You know, the treatment of vitiligo has actually gotten quite advanced, particularly in like my career as a dermatologist. You know, when I was a resident, it was in the early 2000s, like 2003 to 2006, and there was a new laser device that had just, you know, come out called the eczema laser. And there was one doctor at Mount Sinai who would treat patients with the eczema laser. He would use that laser to treat vitiligo, other conditions as well, psoriasis, some patients with eczema, etc. And it was the first I really heard of it. I didn't have any exposure to it at all, to be honest with you. As a resident, I just knew that this one particular doctor would treat patients with vitiligo. I think there were clinical trials actually at the time that were going on. So really, that was like the first very significant option that was showing a lot of efficacy for vitiligo patients. Pretty soon into my private practice, I have I have two offices, like I said, like you mentioned, one in Manhattan, one in Long Island. But I have a very significant population of patients of color, a lot of Indian patients, a lot of just darker skinned patients in general. A lot of times patients will seek me out because I look like them, and their feeling is maybe I'll have a better understanding of their particular skin conditions. So I started seeing a lot of patients with vitiligo pretty early on in my practice. And I have a narrowband UVB phototherapy box in both of my offices. And for patients who have extensive vitiligo, we would use that to treat our patients. And we had some good efficacy. One of my very first patients was actually an Indian patient. He's actually from India, came here he was a banker on a visa. And I'll never forget him. He was like, he used to come 3 times a week for phototherapy. He had very, very extensive vitiligo, and he was actually getting some pretty good results. You know, like you mentioned, in the sea of white, there'd be little tiny dots of pigmentation, and those dots slowly start to expand until they, a whole area is repigmented. But there were certain spots that were very resistant to being treated. Some of the areas on his face and his hands, they weren't really responding. And actually, I bought my first eczema laser around that time. It was probably like 2010 or 2011, like pretty early on into my practice. And I realized like it was really, for patients that are willing to commit to it, it's a big commitment. You have to be able to come to the office 2 or 3 times a week. But for my patients that were very motivated and it was easy for them to access the office, we're getting tremendous results. Really, I mean, nearly 100% repigmentation in some patients like Muhammad. And so, it was awesome because when there really wasn't much, I'd say in the 90s, in terms of treatment for vitiligo. There's a lot more that's available now, and there's a ton more stuff even in the pipeline. Like you mentioned that you were in a clinical trial with some JAK inhibitors, which are really kind of attacking the actual, immunology of vitiligo. That's very promising. That's something that wasn't available before, and something that's being developed for our vitiligo and alopecia are very kind of closely related in terms of the science and the immunology behind them. So same sort of thing for my patients with alopecia. Now there's all these other options that are opening up for them as well. So it's an exciting time. I mean, medicine it's always exciting because there's always new stuff in the pipeline, but to be able to actually see it in use and actually benefit patients in the real world, it's amazing. So yeah, there's a lot of hope for vitiligo patients for sure.
It sounds very promising. Every time I hear that people show like confidence into getting the treatments and making it work, it just sounds that we're going into the right direction. Because I always looked for something in terms of cure.
So, of course, as always, very, very profound knowledge given by Dr. Mudgil. I've just been, taking some notes here just on, some of the things that have been discussed. Starting with, my case of vitiligo and the eczema laser, I have seen tremendous results very quickly. I do go to Dr. Mudgil for all my treatments, and, him and his entire staff and team do, nothing short of a stellar job. When I first started treatments, the vitiligo was all the way up like the side of my face. And now it's just like a small, tiny, tiny patch. And, by the grace of God, I want to say that, my skin responds very, very quickly to the treatments. I have it in several areas. I have it on my hands, I have it on my feet, but it's not really so prominent, nor is it as prominent as it used to be. Going to, alopecia, which was just discussed. I had alopecia at the age of 19, and it was a small patch. I remember it very vividly, like over here. And, my hair on my face grows like very, very quickly. I wish the hair on top of my head would grow just as fast, but unfortunately, the doc and I were fighting the same battle over here. So, and I noticed one day after not shaving, I had this round patch of no hair, and the skin was smooth as if I just shaved in this one round area. And I was like, what is going on here? And, without really dating myself, it was, far before the eczema laser came into play, and about 13 years before I had vitiligo. And, the diagnosis of the dermatologist back then, and this will be a testament to, Dr. Mudgil and just, medicine as a whole as to how far it's evolved, is that, the doctor was very passive about it when he diagnosed my alopecia at the age of 19. And he was just like, he's going to be born with it. He's going to die with it. He is going to get married with it. He's going to have children with it. And he wanted this whole long prose. And as a freshman, a sophomore in college, I was kind of looking at him like, bro, I'm getting into the years right now. I need to have this figured out. Right. And it magically went away. It just went away on its own, and the hair started growing back, and, life was good. Fast forward now, 10 years, at the age of 29 or 30, I started to develop a very clear patch on my skin in the hair area. Hair would still grow, but they were, just turned white. At these, it was over here, and it was over here. And I just kind of dismissed it as nothing. My dad just kind of looked at me one day. He's like, what are you doing to yourself? And I just really, really had no answer. And, my girlfriend at the time, who's now my wife, she was an aspiring dermatologist at one point, and she, just coined it as you having a hypopigmentation. And, again, at that point, there weren't a lot of treatments available. There was no eczema laser. And I started to see different dermatologists because I needed to be very proactive about, what what I wanted to, do. I mean, it was on my face and it was spreading. And I was, building my career as a professional DJ, and I needed to go in front of people, and I needed to have the confidence to be able to go in front of people. And after various difficult, different topicals and steroids and so on and so forth, I wasn't really like, getting results. And then there were these like, pills that were on the market. I remember one being called like Vitiligo Tab. Dr. Mudgil, I don't know if you ever heard about that. I think we might have discussed it at some point, but I started these like, I guess, homeopathic, kind of pseudo organic pills. And I wasn't really seeing much results from that either. And I never ate fish over milk. I'm actually not a fish eater, and I'm not a milk drinker. So, to just kind of, if that refutes the theory, then, it just kind of speaks for itself. And then, the eczema laser was discovered. And, my wife, again, thankfully she did research and she found out about this, and I started doing eczema treatments, and like magic, my vitiligo spots really started to pigment. But it is a really interesting and fascinating disease, because my face has pretty much for the most part cleared up, but I find that like you have to almost kind of have refreshers. I mean, I don't know if it's unique to myself, Dr. Mudgil, maybe you can chime in on this, but it's not like, for me at least, if this was a clinical study, I would say that, my face will clear up very quickly. My hands and feet will need more work. But if I let it go for, a lengthy period of time without a visit, and I'm gonna have to, email Dr. Mudgil offline after this because I need to restart my treatments, the patches will reappear. And I have, a patch over here. I'm getting one over here. I'm getting one underneath. And it's all in ironically, in the same areas that have been treated and respond very quickly and respond very well. I think based on my findings, and I like to just kind of really do lots of process of elimination and see why this is happening. If I, as a performing artist with my, DJ events, if I'm like overlapped with gigs and a lot of gigs, there is a lot of stress that is going through my body when I'm like on that stage, because, in my world, you're only as good as your last party. And when, luxury clients like, Shiri and how we met like at the Plaza, when they are putting their trust in Suhail, they're basing that on the past. They're not basing that on the present until I actually start performing. So there's always that, I guess, level of level of standard that I just kind of hold to myself. And I really just kind of put that pressure on myself to always be able to deliver, and not just only be as good as my last performance, but to exceed my last performance. And, when you have a lot of this, going on, just performing as an artist in general, especially in these days, it's very stressful. I think, I want to say Ed Sheeran was just on tour and he like canceled his tour. He's just taking some time himself to better his mental health. So I think, the doctor will probably, attest to this as well, is that, we're in a world now where, especially after the last couple of years being in the pandemic, your mental health is just as important as your physical health and your physical appearance. All these things are very important. And I really feel it just kind of really starts at the top with your mental health. I want to talk about the hereditary aspect, because this is really interesting. When I first noticed the patches over here in 2004, and I started, seeking out various treatments, I was told that my grandmother on my father's side had a white patch somewhere on her body. It wasn't on her face. I don't remember it being on her hands, but I was told that she did have a white patch somewhere. My father never had anything. So if it is hereditary, it skipped a generation from my grandmother to me. My eldest son, who is now 11 years old, I noticed 8 years ago at the age of 3 that he has vitiligo in certain areas on his body. So I think it's all very interesting. I think, you know, talks like this and more research as it's done, and, you know, prominent doctors like, you know, Dr. Mudgil, who are at the forefront of, you know, doing the research and putting out content and letting people know that this is something which is treatable and something which is you should not be ashamed about. I think it's all going to really, really help to, you know, ultimately one day like find a cure to this.
I think so too. If I could just touch on a couple of things. One is, one of the things that Suhail said was a correlation between like stress in his life, and that it actually is, there's a major correlation, like stress and sleep deprivation with any autoimmune disease in general, but autoimmune skin diseases in particular generally cause exacerbations. So vitiligo, psoriasis, lichen planus, eczema, all of those conditions tend to flare in times of stress and sleep deprivation. So it makes total sense with what you're describing in your own life. And the other thing is, in terms of like maintaining treatments. So Mohammed, who was the video, it was from the Dr. Mudgil show, who had a very, very dramatic result. He actually has kind of regressed a little bit since that show, not only because he couldn't keep up with treatment. So he works a full-time job and was going to school at night. So his life got very, very busy. So, you know, in the years after, he kind of started to get, his vitiligo started to recur. Again, whenever he's ready to resume treatments, and then COVID happened and all that sort of stuff. But whenever he's ready to resume treatments, he will rebound very quickly because obviously, you know, he has a track record of the treatments being efficacious. And I'm same for you, Suhail. It's like, you know, you don't need to do them with the same frequency, most likely. Like you'll rebound really quick. The immune system has this weird kind of memory. But it's like, you know, it's a chronic condition. So there's not like a one and done type of situation where everything repigments and you're cured. Generally, you know, you may go into a long period of remission, but then as time goes on, you may need little touch-ups here or there, and, you know, a couple of weeks worth of treatments.
So you mean to say that just like, you know, any other autoimmune disease, like for example, even diabetes, people do take insulin to maintain their sugar level. So it's the same thing, like you take the treatment and maintain the skin color.
Yeah, I mean, not with the same frequency. So initially you come like 3 times a week until you're fully repigmented. And at that point, we start cutting down twice a week, once every other week, once every few weeks. And then we'd eventually stop. But if my patients will typically start to notice some activity, you know, usually after several months or maybe even after several years. And at that point, they just start coming back for treatments again. I mean, it's possible you go into remission forever. I've seen that also, but that's more the exception than the rule.
That actually brings me to one other question that I had, like, how vitiligo like starts discoloring cell by cell. I've also seen like, so, you know, of course, my family is also concerned that if somebody else develops the condition too. And certain times, like, you know, somebody falls and they scrape their skin, and then you would see like a white discoloration, but eventually it colors. Is there a way to like differentiate just a skin discoloration to vitiligo?
It's tough to do in patients with vitiligo. So there's actually something called the Kebner phenomenon,
Okay.
which happens in vitiligo. So if you were just to scratch your skin and like, or traumatize your skin or cut your skin, you might develop vitiligo in those areas. So sometimes vitiligo localizes to sites of trauma. In darker skin folks in general, if you have trauma, you either get what's called hyperpigmentation or hypopigmentation. Hypopigmentation can look just like vitiligo. It's hard to tell the difference sometimes, but I did have a patient on Tuesday, actually, in my Long Island office, who has very, very mild vitiligo around her eyes, very, very mild. But she also had like these like little areas where there was hypopigmentation, like linear hypopigmentation on her leg and a little circle on her elbow. And, you know, I reassured her that those actually were not vitiligo. Those were just like, you know, trauma related. Those will likely just repigment on their own. But it kind of takes a professional eye to really be able to tell the difference. Sometimes you can't. But that's a good observation. I mean, vitiligo in folks who have vitiligo, trauma can, you know, cause vitiligo in a new spot.
One other question that I had when Suhail was talking about his son, I do like interact with people who have children with vitiligo. Do you have like some kind of insight for them in terms of, you know, how they communicate about the condition to their children? How do they educate them? And, you know, how do they empower them, you know, to just maybe live with the condition or try to get the treatments? What is your insight on that?
With vitiligo that I treat as patients. You know, kids are like, you know, I have 3 kids of my own, and you know, it's parenting 101. You know, like kids are much more, in my experience, I'm no expert on parenting, but are much more like they learn much more from observing you than from things you tell them. You know, so you can tell them, hey, don't worry about it. You're beautiful. Vitiligo is, it's just nothing to worry about. But it's more how you behave in the world, is that's what they see, that's what they learn, you know. And I think for most of my parents, the parents of my patients who have vitiligo, their kids are just kids, you know, like it's they just treat them like they're other kids. There's no, if you have vitiligo, there's no difference on your insides. You know, we're all the same on the inside. And I think, you know, the fact for kids now that there are some treatments that are available that don't hurt, you know, that's the big thing with kids is, oh my God, it's a laser, it's going to hurt, you know, and it's terrifying for them, you know, when they think about it. But when the treatments are actually completely painless, you know, they don't hurt at all. It's, and, you know, once they get through that first treatment, it's like, oh, wow, you know, like I should do something. It doesn't hurt. It's not a big deal at all. And, you know, they start to see the pigment coming back. And if they are like having, you know, kids can also be very cruel in school, you know, and that's, you can't protect your kids all the time from that. Fortunately, in the environment that we're living in now, like when I was growing up, and, you know, Suha, I'm sure you can attest to this, is like, you know, it was brutal. You know, there was no like bullying was just the way it was, you know, like, you know, you just had to suck it up. You know, I used to get beat up at the bus stop every day, and, you know, get picked on. I was like the only brown kid in my school, just get like tortured, but the teachers didn't care, you know. In fact, even in our gym class, I remember like literally the gym teacher would literally split up the teams by, all right, you know, the AP kids over here, the ESL kids over here, and the jocks over here. Those are the 3 teams in the gym class, you know, like it was just so like culturally and like insensitive. And, you know, but now like my kids, like, and the schools all over them about bullying, about, you know, being kind, about social media. There's just so much more awareness about it. Parents also are a lot more in tune, you know, and I think it's just it's a gentler time. I mean, I hope it is, but I think that awareness makes a big difference. Things like this, talking about it, posting about it on social media. You know, there's a lot of like prominent folks who have vitiligo who, you know, are posting about it, you know, on Instagram. You know, there's some supermodels who have vitiligo that are, you know, revealing themselves in their natural state. And, you know, those are incredible things for kids to see. It's incredible for adults to see as well. You know, it just, that positivity, listen, you can use social media for good, or you can use it for bad, you know, it's like anything else. But, you know, I feel like light always defeats dark, you know, kindness always defeats negativity. And the more that we put out there, the more forums there are like this, and the more awareness that there is, it makes it easier for kids to deal with it, you know, because it's not easy to deal with. You know, I mean, you know, like I said, kids can still be cruel, and, you know, kids can still feel hurt. And, you know, kids are also very honest. Like, you know, why do you have that? They're, in an honest way, they'll ask a question, you know, and they don't mean any malintent, but sometimes you start, like, oh man, why am I different? You know, but fortunately, there are outlets now where you can seek solace and get comfort, and, you know, regain your swagger and confidence, you know.
Thank you. Thank you so much, Dr. Mudgil, for that. It was incredible to actually talk to you from a perspective of living into the first world country, and then, you know, talking about the generation back ahead, and also talking about generation ahead of us. And I think this only puts more confidence into having this kind of conversation without being judgmental. And of course, I agree with you, with all Indians are judgy in a way or two. And I think just people like you who empower us to come up and have this kind of conversations, I think this will lead us somewhere more positive towards especially the conditions that are more visible and that people are struggling with. I really, I truly and really am thankful for your time today. And I really appreciate all your insight today on vitiligo.
Well, thank you so much. I appreciate you for doing this.
Thank you.